there are multiple ways to define addiction, of course, but in medicine, when we think about when people come to for health care, we think of addiction in terms of the DSM term. The DSM is the Diagnostic and Statistical Manual. It's produced by the American Psychiatric Association, and in that book, it has a clear definition of what addiction is. Addiction, typically we think of it as people may exhibit tolerance to a substance. They may go through withdrawal when they don't have the substance. They may spend increasing amount of time engaged in the behavior to obtain or use the substance. They may have had unsuccessful attempts to cut down their use of the substance. They may use despite the fact that they are having psychological or physical problems. These are sort of the hallmarks of addiction. So like when people use the term in popular culture, they typically have another perspective in mind. Some people use things like, I'm a shopping addict, I'm a chocolate addict or something, and that's a more benign use of the term. But then there are other people who use the term and they think of things like folks who will steal your money and rob you, they're addicts. You can think about it from a biological perspective. With alcohol, people tend to think of folks who have a parent, for example, who was an alcoholic. They may have an increased likelihood of becoming dependent on alcohol. Why that's the case, we're not entirely sure, but people are looking at genetics and other biological markers, but we're not real sure, but we certainly think that they may have an increased likelihood. And then there are, of course, there are important social factors. During certain points of your life, you may be more likely to be addicted to a substance because of some conditions under which you are experienced. You don't have a job, you don't have any responsibilities, you have greater access to a particular substance than you normally would have. All of these things could increase the likelihood of someone becoming addicted.